one key element of this medicine, and one of the big reasons why I feel it's very unique, is that we determine what we're going to treat exclusively by what the nervous system tells us. Most of the time, you're going to find points on the ear that are active that relate to a specific symptom. But a lot of times, you're also going to find points that don't seem to relate to the symptom at all. What this indicates is an associated element of the treatment that you might not have thought about. What I want to talk about is trusting what you find, because in a lot of the approaches in Chinese medicine and in conventional medicine, we take the symptom picture. So we, in whatever ways that we're getting the symptom picture, or the diagnosis or the assessment, we're saying, okay, so here are the details about how this person is ill and why they're ill. And so here is a recipe of things that I would then apply to this patient. However, we're not really taking advantage of the nervous system of the patient, in the sense that we're not asking the nervous system of the patient directly, what is the best treatment? If you find an active point that relates to, let's say, a shoulder point, and they have no shoulder symptoms, it relates to a knee point and they have no knee symptoms, nothing that they can think of, the ear is telling me that there is a connection here, okay? That this knee is important in this picture. In some cases, you ask them about the knee and they'll say, well, nothing ever happened to my knee. I don't know what you're talking about. And in that case, you want to also consider that there is an old injury or something that happened to the knee that they just don't remember. And some trauma, especially if it's early on in life, is completely outside of the conscious memory of the patient. The ear is a map of the brain, okay? But it's a dynamic map, meaning it will only show you what is currently affecting the system. So that means if you find a point from 25 years ago, it can only be because it's still affecting that person. In this we get into focus activity, and I want to introduce that idea as an example for today of how important it is to trust what you find, because you don't have the whole story. Your patient doesn't have the whole story. Even though it's about them, they don't have the whole story. Their doctors don't have the whole story. Even if you put all of that information together of what you know, their doctors know, what they know, you still have a very small part of the story. But their brain, the patient's brain, the patient's nervous system is holding the whole story. It's just a matter of us, the auricular practitioners, learning how to access that information.